Ask the Doctor time, and this morning we are talking about eating during the holidays. This morning, trying to stay heart healthy, making those choices when you could be tempted not to do so. Dr. Kristen Brown from Princeton Baptist Medical Center joins us this morning to talk about that. Dr. Brown, good morning. Do we have Dr. Brown, guys? There we go. Dr. Brown, good morning.
Good morning. Thanks for having me.
It's really good to see you. So what we're talking about today, this is not just, oh my gosh, you don't need to overeat during a holiday. You're talking about people who may have perhaps preconditioned issues that you don't need to overeat or eat certain things, right?
Correct.
All right, so what are you looking at if you do have, say, cardiovascular issues?
So typically, if you have predisposed cardiovascular health problems, the holiday season is a very, very important time for you. It can be very difficult to balance healthy eating and exercise with all of the holiday activities. And it's really important to know that there are steps, self-care steps involved that can keep you on track, and healthcare professionals that you can refer to.
All right, well, let's talk about those. I mean, we all know that most days like 4th of July, it's going to be hamburgers, hot dogs, ribs, those type of things, and that might not be what you need. So what do you suggest?
Yes, so like I mentioned, for the cardiovascular health problems patients population, heart healthy diet amid an abundance of holiday foods can be quite daunting. So keeping to your normal diet is probably preferred. If you can dabble a little bit, but trying to not stray too far from your normal diet is really important. Keep portion sizes small and limiting all those fatty foods that are all over our tables, because it's so important for these particular patients. If you increase certain things like salt or sugar or fatty foods, it can lead to worsening health problems, chest pain, shortness of breath, and also, and very important, try to limit your alcohol.
So you're saying that even if you ate too much of certain items and you have a cardiovascular problem, you could experience shortness of breath or chest pains?
Absolutely. These patients, they even on a normal day have to monitor very closely their salt intake and their sugar intake to manage their diabetes. Our cardiovascular patients are more than just heart problems. They have diabetes, hypertension, and you name it, they probably have it. And it's important for them and the people around them to support them in those healthy decision making.
We were looking at that list of items there that people need to look out for, and a couple of the things on there I think can relate to anyone, and you manage your stress. Talk about what stress can do.
Stress can raise your blood pressure. It can cause, other systems in your body, your brain, to not activate properly on a daily basis. It can also just make your decision making about your health off. And so it's really important to keep level-headed. If you need to take time for yourself amid the holiday season, do so.
Do we know why some people stress more than others?
That's a good question. I think there's predisposing factors to our patient population and everybody in general. Somebody one year might be stressed and then the next year not. It depends on how much they're focusing on their self-health, exercising, and keeping around good people that support them.
All right, something all of us can look out for with each other. Dr. Brown, thank you.
Thank you so much for having me.